Good afternoon. I'm going to talk about the contributions that nurses can make to this problem and to its solution. And I'm going to focus on my population of interest, people with cognitive impairments, that is, older adults with dementia. So, dementia is an umbrella term like CAR, Alzheimer's, Lewy body, frontotemporal, vascular. Those are all types of dementia. Because so many times I have people who say, well, my dad doesn't have dementia, he has Alzheimer's. Okay, so nurses, we travel in packs. As a matter of fact, to my fellow nurses out here, today, or this week, is National Nurses Week, so thank you for all that you do. There's almost, thank you. There are 4 million of us in the United States, and a little over 250,000 of us are nurse practitioners. I'm an adult nurse practitioner, which means I can see everybody age 13 to 113. 89% of us are certified in primary care, and we also have almost 12,000 nurse midwives. So we are well positioned to look at people's oral health and make referrals. It also helps that we are one of the most trusted professions. And I identify myself as a nurse first, and then I tell people I'm a researcher, because I get more bang out of being a nurse. I say I'm a researcher and doors shut. I say I'm a nurse and doors open. And I really do perceive myself as a nurse practitioner first with a research component. So, and we are everywhere. In long-term care, we are a key interprofessional team member because oftentimes we are the primary care providers in long-term care. One of my first jobs as a nurse practitioner was in a nursing home that was 90% Medicaid. When my practice started there, it was a couple of geriatricians and me, and we had maybe 25% of the nursing home, but because I was there all the time, by the time I left 4 years later, our practice covered 90% of the 250 residents. Families loved that I returned phone calls and they could come and find me. And what I learned in that first job was a lot of the behaviors, the disruptive behaviors, let's give them antipsychotics, no. It was usually generated from mouth pain. I was called into a room to see a new admission, and she'd come from another facility and had been in there for 3-4 months, and the family hated it, so they sent her to ours. And when I was doing the intake, I noticed someone wrote natural dentition. Well, I open her mouth and I see the ridge of the denture. Her dentures had not been removed in 4 months. Yuck, yes. Guess who got them out? I won't gross you. Well, you're all dentists, you all know what it looked like. She had really bad thrush. And that's why she wasn't eating, that's why she was slapping everybody, because she had dementia and probably had delirium from the fungal infection. I pop out those dentures using a lot of the care-resistant behavioral techniques that I do for a living, hit her with some nystatin. Within 2 weeks, she's eating, she's much happier, she's not refusing mouth care. You also see decay and tooth loss in this population, weight loss, or in some cases weight gain, because the people will only eat the soft junk food type diets that my colleague just mentioned. You get nutritional deficits without the weight change, and if your B and D vitamins are affected, you have cognitive changes that people do not really pay a lot of attention to. And oral infections are linked to systemic infections. So what I do is I look at what is the primary barrier to oral hygiene. We used to write time on everything. No, in about 2007, when I was getting funded by NIDCR and I was really focused on this area, I mean I still am, but when I first started going in, the nursing assistants all said to me, we know how to brush teeth. We can't get into the mouths. So I started combing the literature, and I also started out as a nursing assistant in 1982. So in 2022, I will celebrate 40 years in long-term care, but knowing how to leave, because I have the button, I have the code to get out. It's kind of scary now because I walk in and I make sure I have a uniform on and an ID badge, because one day I walked in street clothes to come in and work with my team, and I didn't have makeup on. I'm sure I looked a little rough, and I asked one of the CNAs to buzz me out, and she told me to go sit down. Yeah, F my life, right? So, woo, that was fun. Yeah, I mean, I'm thinking, gee, so I now put makeup on and have an ID badge. The good news is my kids are so excited. They said, Mom, when you get dementia, because honestly, it's not a matter of if, people. It's probably a matter of how old we get when it happens. Sorry. But they already have a plan. So when I go into a nursing home, they're just going to tell me there's a research study and go change the code. But one of the things I have done, I've been funded by NIH, and I did a really large randomized clinical trial where we went into 9 nursing homes, 4 in Pennsylvania, 5 in in Alabama. And we have strategies that enable us to get into the mouth. So I partnered with Alcora, and we developed these oral care cards that you can purchase with no cost if you live in Washington State. If you're outside of Washington State, you can order them. But these are really cool. These are laminated cards. They're about about 5 by 3 with a nice little spiral, and they have every one of my interventions on a separate card. And we worked with an artist to illustrate them. So this is really cool when you do research, and hooray, it is being applied in people's daily lives. I also partnered with them to do a set of videos to help teach oral health techniques to caregivers dealing with people who have intellectual disabilities as well as older adults. And that went live in 2018. One of the things we found in one of our studies is that you can get away with only brushing teeth once a day. I know that is heresy. But when you are dealing with individuals with cognitive impairments who are highly resistant to care, if you keep trying to brush their teeth, you can escalate the behaviors. So you have to figure out the sweet spot where you are giving excellent mouth care, but you are not agitating the behaviors. And care-resistant behavior is different from agitation, 2 separate things. And what we found with a handful of people, this was a proof of concept type study, is the green was the amount of plaque before we started brushing, and the yellow was the amount of plaque after 5 days. And we have an intraoral camera that we use that can distinguish new plaque from calcified plaque, which is really helpful. And my co-investigator, Mia Geisinger, many of you know, she interprets the films, gives us the plaque scores, and she's a really important member of our team. So we made a difference in just once a day brushing. And we also did some microbiome analysis, because the current thinking is that the mouth as a reservoir for bacteria, it's not a species or one Klebsiella pneumoniae that causes the pneumonia, it's actual neighborhoods of bacteria. And if you have all the good neighborhoods that go to seed because of inadequate mouth care, and all the bad bacteria proliferate, they can actually break off in little colonies and circulate as a whole bacterial neighborhood throughout the body. It's called the dysbiotic hypothesis. So the green in there is Clostridium, the Clostridium genus. And you can see that over time, it shrinks in some of our groups. So right now, we have a project called Brushing Away Infections that was funded by Medicare, funded by civil penalty monies. Every time a nursing home misbehaves and receives what's called an F tag, they are fined if the F tag is severe enough. So those monies are put into a pot, and you can apply for those monies if you are doing a demonstration project that has direct benefit to the residents. So we are in year 1, and this was the most recent nursing home we were in, where when we started the project, the blue line is all the respiratory infections, and the orange is pneumonia. We started in January, and this is data that we collected as of March, and from the time we started until March, we had no cases of pneumonia. And when we ended it last June, I don't think we had any cases of pneumonia in this facility for the 6 months we were doing the project. So what is the project? We are teaching nursing assistants, yes, evidence-based mouth care. We are also teaching them the behaviors to get the toothbrush in the mouth. And we supplement that with RNs in the field at bedside doing one-on-one coaching. Because I can do all the didactic I want, and then you have to get into the bedside and deal with that person's behavior. So a dental Medicare benefit would definitely benefit the 6 million people with a dementia diagnosis and would help, and even though we can remove soft plaque, wouldn't our interventions be so much better if we could get the hard plaque removed? So again, I think that all of us together are important in generating better oral and systemic health outcomes, and a Medicare benefit for preventive oral health services would be amazing. So thank you for your kind attention.